Hello, good afternoon. My name is Lindsey Ebaugh. I'm the CEO of ABC Medical Center. And today I want to go over with you the new EHR system we will be going live with on September 3rd, called Scribe Electronic Health Records. As mentioned, we will be going live with this new EHR system on September 3rd. Today I will explain the system and how it will benefit ABC Health Medical Center. How this system is to improve some of our patient engagement is what I'd like to go over first. Did you know issues relating to medication adherence cost the economy $300 billion? Even worse is that this issue alone is one of the primary causes for patients being readmitted to medical facilities. By adopting the use of Xscribe electronic health record system, we are hoping to reduce the medication adherence issues. Let's go ahead and take a quick look at ways electronic health records can improve patient engagement and improve the healthcare for our patients. By making the switch to the system, we can reduce the patient phone calls, decrease postal expenses, and enhance the house workflows thanks to the streamlined processes. Just some of the tasks that our patients would be able to accomplish through the AHR patient portals do include viewing the clinical information. This includes any information that is given to them by their doctors, such as educational information or what types of prescriptions they have to take. They can also pay their bills, ask for referrals, reach out to their doctors for prescription refills, as well as schedule their appointments. This means that they don't have to spend any more time waiting to speak with their doctor or their doctor's nurse over the phone. I know that those phone hold times to get a hold of your doctor and waiting for your doctor to call back can be kind of long, so that does save us a lot of money in the long run. Also, many hospitals and clinics have begun to use this new EHR system, and so many physicians have testified that patient engagement has increased via the EHR because of the accompanying portals that allow the patients to securely send and receive confidential emails. If a patient has a question about a suggestion made by the physician during an office visit, the patient can log into this EHR portal and send a secure email outlining his or her question. The physician can then respond in a timely manner, all without ever having to make a phone call. This will also increase a patient engagement thanks to the patient education that takes place via the EHR portal. Patients can log into portals and review pertinent information relating to their prescriptions, including dosage recommendations, harmful drug interactions, and much more. Another neat aspect of the patient education via the EHR portals is that it can be provided during the actual office visit. So now the physician can log into the system and print out the educational material that is linked to the specific diagnosis. And being able to send the patient away with that valuable educational material is an excellent way to improve patient engagement. They can also, per se, read a little bit of that educational during the visit, and then if they have any questions for their physician or their nursing assistant or their physician's assistant, they can ask the questions right up front. That's why these systems are so helpful. Now, we can also use social media tools in the communication for our patients as well. This is because with patients increasingly becoming involved in their own care, it is no wonder why social media wasn't introduced a long time ago. While healthcare organizations have been using social media for marketing and branding purposes, as long as any other business sector, they have been understandably reluctant to place tweets and Facebook posts on the same level of importance as what patients say in the consult room or exhibit during a physical examination. But millions of people do share the intimate details of their lives with their network of friends and acquaintances. They may complain about feeling nauseous after taking a new medication on Twitter, but not to think it's worth calling their doctor about or they can post a picture of their ankle swollen after they fall, and they don't realize they should be seeking medical attention for that sprain. Through our new EHR system, we can connect with our patients through text messaging, Facebook, Twitter, Instagram, LinkedIn, and other professional networking sites. This can also be used for such things as smoking cessation, diet plans, and health tips. What we can do is we can create a Facebook page or a Twitter page for ABC Medical Centers and just include little health tips on there for our patients, tips for smoking cessations, tips on diet plans to help them out if they are diabetic, if they have to follow a certain type of health diet plan. And then just having those health tips and everything at their fingertips is very useful for our patients, cause so they it does increase our patient involvement here. Now, a lot of people ask, with this being on social media and with this having the patients so involved in their health care by having the patient portals, how will this system protect the patient privacy? Well, EHR is a communication tool that supports clinical decision making, coordination of services, evaluation of the quality and efficiency of care. It does research, legal protection, education, and accreditation and regulatory processes. It is the business record of the healthcare system. Whereas the doctor owns the physical medical record, the patient owns the information. So the documentation must be authenticated, and if it is handwritten, the entries must be legible. Patient privacy is protected by the system being password protection. Each person, per se the physician, the nurse, the medical assistant, whoever it may be, who uses this EHR system, they have to be authorized to get into this system. The system also includes clinical decision support. What is clinical decision support, you may ask? Clinical decision support provides clinicians, staff, patients, or other individuals with knowledge and person-specific information intelligently filtered or presented at appropriate times to enhance health and health care. CDS encompasses a variety of tools to enhance decision making in the clinical workflow. These tools include computerized alerts and reminders to care providers and patients, clinical guidelines, condition-specific order sets, focused patient data reports and summaries, documentation templates, diagnostic support, and contextually relevant reference information, among other tools. Clinical decision supports patient safety. Clinical decision support can impact improvement in quality, safety, efficiency, and effectiveness of the healthcare. The Office of National Coordinator for Health IT supports efforts to develop, adopt, implement, and evaluate the use of CDS to improve healthcare decision making. We here aim to help the healthcare industry create a technical infrastructure needed to allow healthcare systems to share data with each other electronically to provide the most complete information possible into CDS systems. Complete records allow CDS systems to help with diagnosis and track for negative drug interactions by having a better view of the patient's whole health. So it helps us with providing the dosage information and whatnot. Clinical quality and safety measure results, prioritize improvements, implement, monitor improvements, issue tracking, health IT safety. The clinical decision support implements health IT safer guidelines. So we aim to make sure CDS is implemented in all healthcare organizations. Why CDS? Well, CDS has a number of important benefits, including the increased quality of care and enhanced health outcomes, avoidance of errors and adverse events, improved efficiency, cost benefit, and provider and patient satisfaction. CDS is a sophisticated health IT component. It requires computable biomedical knowledge, person-specific data, and reasoning or inferencing mechanisms that combine knowledge, and data to generate and present helpful information to clinicians as care is being delivered. This information must be filtered, organized, and presented in a way that supports the current workflow, allowing the user to make informed decision quickly and take action. Different types of CDS may be ideal for different processes of care in different settings. Health information technologies designed to improve clinical decision making are particularly attractive for their ability to address the growing information overload. Clinicians face and provide a platform for integrating evidence-based knowledge into care delivery. The majority of CDS applications operate as components in comprehensive EHR systems, although standalone CDS systems are also used. So as mentioned, we're going to take use of more social media interaction with our healthcare, with our patients, to fully get them involved. This is going to go live on September 3rd, as mentioned, and the program is called Xscribe Electronic Health Records. If you have any questions or would like to know more information, you can reach out to me at my email address, lebaugh, that's Lebaugh, at abcmedical.org. Or please feel free to reach out to your charge nurse or head doctors. We look forward to implementing this system with a lot of great success. And I hope you guys enjoy the new system as well, as it'll make your jobs easier. I do want to thank you and have a wonderful rest of your day.